Hello and welcome to the Simply Free Little Talk. I am your host, Free Little, and I am here today with Health Matters, and we're just expecting Dr. Kenya. There was just a little delay in her arriving in the studio, but we know she's coming on soon. So I just want to thank you again for always tuning in to Simply Free Little Talk. I thank you for supporting Health Matters because this is something that's very important to me to make sure that people are receiving the best healthcare treatments that are available to you for whatever challenges that you may have medically, but also if it's just you wanting to remain healthy. As you all know, y'all have watched me within exactly 1 month's time, I have lost 22 pounds from Tava Lifestyle products that we have. We have four products, and health is really what I'm enjoying. Hello, Miss Thomas. Thank you for your support. I just wanted to say to everyone that Simply Free Little Talk was totally created by God. Hello, Carlos. Thank you so much. And I can see that He's manifesting everything. Thank you. It's always great to be seen and to see others and to thank God that others want to see me as well. So, what I'm saying today about Simply Free Little Talk and the health matters is our health is crucially important. So I'm so grateful that Dr. Kenya is coming on today. She is a physician at the UT Health in here in Texas. And I'm just excited that we're back together again. It's been a long haul. We've had some challenges on both ends to bring health matters together. And as y'all seen me transform to a lighter 22 pounds and counting down. So, with that being said, Dr. Kenya will come on today. She will talk about preventative care. We have to do things. Even with my weight loss, I know that I have to exercise. I have to continue to eat the right foods, intake the right foods like vegetables and plenty of alkaline water. If you are like myself in your 50s, heading towards 60 plus, then you need to drink alkaline water, especially the females. It helps with our pH balance. But someone shared with me recently that alkaline water is also something good um, that we need to do, okay, for our bodies. So, if you guys just give me just a second here, I'm trying to see. Uh, all right. Sorry about that delay. Dr. Kenya had a little moment that we're going to get her back into the studio. But I just thank everyone for tuning in again. And thank y'all for always being faithful in your tuning in for Health Matters. We're having some technical difficulties that you can't see of getting her in, but she will be in shortly because I never want to miss an opportunity for education to go forth, for revelation to go forth. Thank you so much again, Carlos. I really appreciate everyone's support. I really do. I thank everyone who joins on Facebook Live, everyone who joins on YouTube and LinkedIn, and just having an opportunity that we're getting what we need, and that is education for our health to become the better us spiritually. Let's go back to it physically, mentally, physically, and spiritually. We need that. Thank you. Yes, I'm here today. I'm here to make sure that we get the right health matters, that we really know what God has for us, expects for us, and how we can improve on our bodies. We need our bodies to function accordingly. So that's why preventative care is crucially important. Oh my goodness. Yes. Okay. Sorry about that, guys. I am trying to see what is. Yeah, sometimes we have these things that happen. That I always say that if there's a delay for any reason and whatsoever, it is because the information is crucially, vitally important to us. We're going to learn something that is necessary to improve on our health. And health matters is crucially important with everything that we've experienced from the pandemic to just health issues and matters that I'm hearing that people are experiencing these days that they've never experienced before. I know you've heard it. I've heard it. I've seen people dealing with health matters in their bodies that we've never heard of, or we've never experienced these things before. Unusual things that is happening. So I thank you guys again for being patient. And to Dr. Kenya actually arrives. I'm sending her messages now. We're just trying to see what's going on. But again, health matters is crucially important that we take care of our bodies. That's the whole point of today's show. Preventative measures, learning how to have a relationship with your doctor, talking to your doctor about all matters. You need to do that. That's like the main thing that all of us need to do is have that rapport with our doctor, have that communication, open line of communication, share with your doctor what you're experiencing, the things that you have been challenged with, how long you've been challenged with these things, what have you been doing or not doing. It's crucially important for us to care for our bodies. You only get one. You only get one. We know that modern technology has improved a lot, but it's still up to us to make sure that we're caring for our bodies. Yes. Okay. I'm sending another message to Dr. Kenya to see when she'll be able to join us. But those that are waiting, if you can just drop in the comments, I have no problem with you dropping in the comments some of the things about what you would like to hear that we will bring forth to the Simply Free Little Talk concerning your health. As I stated earlier, I did a little commercial earlier about the things that is coming forth with our Health Matters show. We're having more nurses to come on. We're having more techs that are coming on to talk about CTs, scans, MRIs, people that are going to be coming on to kind of help us out with the health matters so we'll know more about how to identify things happening in our body. We know that this month alone is mental health, and we've been making people aware of how treatment plans that are out there for mental health, how to go about getting assistance in your area, and how to identify people that are in crisis. I had a talk not maybe about two days ago, and I mentioned that even I have seen people that have had mental breakdowns who have not had or received the proper treatment, but they looked perfectly fine on the outside, looked the part, smelled the part, wore the makeup or didn't wear makeup. It could have been a male that just looked healthy and fit, but really on the inside, people are suffering in silence. And so, if I can't get Dr. Kenya on, I definitely can talk to you about mental health illness today. And that's also a part of preventative care. If you do not stop and identify that there is an issue going on in your mental capacity, that you're not getting the proper rest, that you are not having good clarity in your thoughts or even in your articulation. Those are signs that some things is happening. Appetite changes. Just overall, your desire, energy, or lack of energy. Someone who's avoiding addressing matters that need to be addressed. Those also are things that we need to do to help with our mental state. And so I want to encourage you to attempt to just send me something in the comments. I want to hear from you today. I always want to hear from you, but I really want to hear from the audience today with mental health because this is the month for mental illness. And I know that you and I both have had someone in our family that has dealt with mental illness, still dealing with mental illness. And how does that affect you? How is that affecting you as a person that may be healthy otherwise, but you see someone who appears healthy on the outside, but you can tell mentally that they're struggling. We have people that are dealing with identity crisis. They don't know who they are, they don't know who they belong to, and they do not know how to ask for help. And so it is up to us to take the time to spend time with our loved ones. I think it's crucially important that we spend time with family, we spend time with friends, but really get to know people. Not knowing someone because you know Free Little's name, but do you know Free Little? Have you taken the time to talk to me? Do you know any things that I like or dislike? What are my morals or non values? We need to create conversations with people to know where they are. And it really doesn't take you that long once you start communicating with someone what is irritating, what's frustrating to them. Even my 12-year-old grandson mentioned recently to me that someone was frustrated. And I'm like, if he's 12 and he's understanding that someone is frustrated, then we too should be able to identify the pain of others or the frustration. Yes, people do mask their hurt very well, but I just want you to know that we need to talk about these things. We really do. And so, if we can't get Dr. Kenya to come in, let's talk about mental health. That's also a part of preventative care. And preventative care is you taking care of yourself. Are you eating properly? I said that earlier. Are you drinking plenty of water? Are you getting some cranberry in your system? You getting some veggies? Like, remember when we were kids, we were told eat your veggies. That was a reason that the elders or those of old would say to us, eat your veggies. They knew because we needed the nutrition that's in vegetables. We also need what's in fruit. And so healthy eating is almost a necessity to survive these days. It helps with your skin. We need to do things that help with our skin. Take care of our skin. Take care of your heart. Take care of your lungs. Yes, we have a lot of people using synthetic smoke that's affecting them. Hello, Miss Tanya. You have people that do not realize they're doing damage to their body with the intake that they're putting into it. Remember the old saying, but it's also a statement today that people use: you are what you eat. Well, you become that which you are intaking inside of your body, and it affects you. So you have to be careful of what you are allowing inside of your body. Again, I want you healthy. I want you strong. That's why Health Matters exists. And I really am hoping that Dr. Kenya can get on in here and tell us some good things. But if not, we've talked about mental health. We're talking about the health of your you. If you are dealing with stress, where it is overwhelming to you, where your mental capacity is being affected and you're not being productive, if you find yourself always sleeping and lacking energy and really, or even a little discombobulated, and that's okay. Thank you, Dr. Kenya. She's logged in to say that she's having some technical difficulties and she apologizes. She's such a sweetheart. And I understand, Dr. Kenya. And I thank you, audience of Simply Free Little, that is being extremely patient with Dr. Kenya attempting to get into the preventative care show that we have today, all ready and designed for you guys to receive some great information. So let me just share with you some of the things that Dr. Kenya would like to share with you guys. What is preventative care? She's going to share with you guys in details exactly what preventative care really is. Hello, Tan. Love you, sissy. How often should a person see their doctor? These are questions that I was going to pose today to Dr. Kenya. Well, I'll tell you that you definitely need to see your doctor on a regular if you've been diagnosed with some previous illness, whether you're in remission from it, whether you have no symptoms now, you're not detectable, whatever that diagnosis is, you still need to have a follow up. Follow-ups are crucially important to the next care plan. Did you hear what I said? The next care plan. All of us need a health care plan for ourselves. Your individual treatment plan is a plan that's designed for you, a person that may be experiencing health challenges. Okay, we're going to call Dr. Kenya on the phone, and we're going to talk to Dr. Kenya by phone today. We're going to do that because there are some great things that Dr. Kenya would like to explain with us. We're talking about preventative care. Hello, Dr. Kenya. I have you on the line. Just if everyone will let me know that you actually can hear Dr. Kenya by phone. If you can hear her by phone, give me some hearts, give me some confirmation, because she's on the line now and she's going to talk to us about preventative care. Dr. Kenya, can you turn whatever you're listening to hear the show down so that I can hear you by phone?
Yes,
thank you. Great. Hello, Dr. Kenya. Welcome, welcome, welcome back to Health Matters. We miss you.
Oh my gosh, Bree. I mean, my goodness. So to the audience, if any of you have ever had technical difficulties that are beyond your control,
yes.
Oh my God, that is stress in and of itself.
It actually is. I mentioned stress, and when I mentioned about preventative care, thank you so much. Tan Tate said we can hear you, so that's a good thing. I just wanted you here. So I just talked a little about this month is Mental Illness Month, but also you're going to talk to us today about preventative care. So Dr. Kenya, share with us, what is preventative care?
So people, you are not supposed to do like back in the Western days where people would just show up to their doctor when they got a cut or needed to deliver a baby or were sick. That was back in the old days.
Yes.
Now we've got more prevention, okay? It's all about trying to prevent disease now, not just deal with what's already there.
Yes.
So that is the crux. Prevent bad things from happening as much as possible. That is preventative medicine.
Did you guys hear that? Preventative measure is taking a step prior to something happening and caring for yourself.
Absolutely. So we as your doctor, when we're practicing prevention, the reason why we ask you guys all these personal questions like, are you married? Are you dating? What type of work do you do? What's your housing situation? Your financial situation? All of this, you guys, gives us a snapshot, a little bit of a view into your lives to help us to know how to give you some guidance with healthy choices that may reduce your chances of getting diabetes or exposure to certain, pollutants and things like that might be at the job, or even injuries. Like, oh my gosh, even homemakers. Okay, for all of you folks out there who are just your routine home maker, meaning that, you're basically a stay-at-home mom or dad, you guys, that is work. Oh my goodness, it's work. All that lifting of the children, picking up laundry baskets. Do you know I've got more women with bad low backs or big back pain from nursing using the improper positioning. Okay, and so I'm able to then give you clues, or instruction on how to change your posture so that you don't get pain, okay? Well,
that's good.
That's likely to, I should say. So that's what we do. And then, you guys, the reason why we ask about your family history.
Family history, that's good.
Yes, your family history is because some things run in families, like diabetes, hypertension, lupus, okay, all of these different types of things that can be genetic, but just because you carry the gene does not mean that it has to manifest.
Wow.
Let that soak in for just a second.
I like that. So let me ask you this, doctor. So what are you saying, Dr. Kenya, is that, say, for example, there's a trait of cancer cells that was grandmother had them, mother had them. Now you or the grandchild of the grandmother that it first was identified in. So it's crucially important to me to go to my doctor, but it doesn't necessarily mean that I would inherit the cancer trait or the cell,
So
I'm sorry.
you may have the cancer trait, but it may not manifest. Okay, so just let me take you through a little bit. So let's say you got all these seeds, right? You know how you buy those bags of seeds?
Yes.
And you put them in to plant. Not all of them are going to grow.
Thank you. That's
Every
good. Take.
seed is not going to manifest. And so our genes, some of them will manifest and others will not.
Yes.
And so your question should be, what can I do to reduce my chances of this coming to pass?
That is so good. I have my sissy Tan Tate. She is putting in every comment that you're making to us so that others that are tuning in can understand that you have just explained to us the importance of family history, but it does not necessarily mean that that trait of whatever that illness is going to necessarily manifest in us. So thank you for being so kind to explain that to us.
And let me also explain this. So, like, let's use mental health, for instance, okay? There are some families where schizophrenia is passed on through generations,
Wow.
Okay, or bipolar. And a part of that is not just that they have a gene, but they've got a chaotic lifestyle. They've got a lifestyle where people have not been taught to have healthy boundaries, or they've been in very high stress and not knowing how to cope with that stress. And so it starts getting passed down through the generations because no one has educated the family on how to deal with stressors. Okay? And so then they make life decisions that end up creating more problems for them, like maybe getting themselves incarcerated or becoming an alcoholic or what have you. Getting into abusive relationships.
Wow.
These are all things that will then make that condition manifest. You understand?
Did y'all hear that? That your condition can manifest because of the stress. And so it's important that we get educated.
Yes.
Wow.
Yes.
Good information, guys, on how to cope.
Coping mechanisms. And so let's go to diabetes and hypertension.
Yes.
So to all the listeners, one of the things that I'm noticing, especially in Northeast Texas, is that there's a lot of high blood pressure. I'm not talking to people who are in their 40s and up. I'm talking people 20 years old, 17 years old, okay, that are needing blood pressure medicine. So
20s?
Why? Well, initially we thought that it was high lead content. Nope. It's high salt. Oh my goodness, the amount of salt that Texans eat. Can you in the audience try to give me some ideas of salty foods?
Bag of chips. Y'all put your comments in those comment streets, as Sissy would say.
Yeah.
Of foods that are salty.
Foods that are salty. Give me some common ones that you eat maybe every day, or you go to a ball game, or you're sitting at a picnic.
Sunflower seeds is one of them.
Yep, the salted, so you can start buying. If hypertension runs in your family, you should buy unsalted nuts.
Wow, did y'all hear that?
Another example.
Okay, let me see. Crawfish.
Oh my gosh, any of the shellfish.
Any of the shellfish?
All shellfish are very, very high in sodium. Give me another example.
Pork skins.
Oh my gosh, yes. And then it's fried on top of it. So now you got indigestion
Yeah.
and high cholesterol.
Yes.
Give me another example.
My goodness. My sister said peanuts.
Yep.
Whoa.
Yep. So buy the unsalted. If you just get roasted peanuts,
let me see if I missed
problem.
anything. Oh, McDonald's fries.
Oh, yes.
That's a good one, Greg.
And you guys, here's something that you
Keisha,
haven't thought about. Any processed meat, all processed meat.
Wow. Did y'all hear that? All processed meat. You know what? That's something I've been really trying to avoid is processed meat. I've noticed since I've cleansed my system out, I'm starting to have headaches if I even taste a little processed meat. So that's good. Salty foods like popcorn.
Yep. Popcorn.
Whoa.
Now, why did we get rid of remember the popcorn air blowers, you guys? That
yes.
Was very healthy. That was
wow. Did y'all hear that? Whoa. Okay, wait a minute, guys. There's another one. Pickles. What about pickles?
Oh my goodness. That's the
good one, Keisha.
So
wow.
People, do you know? I don't know any place else in this nation outside of Texas where they sell frozen pickle juice as popsicles.
What? I didn't know that one. Maybe because that's not my thing. Ugh. Oh my goodness.
It is so high in salt.
Really?
So when I know these things, I am able to educate people on how to moderate, okay?
Yes.
So that's one part of prevention. And that's why we ask all of those nosy questions. Because you guys
we need to know
on us to give you guidance in your choices, right?
Wow.
Now, the other thing is, folks, from the age of 2 to the day you die, you should continue seeing your doctor once a year.
Did y'all hear that?
Sick or not.
So we should set up appointments, no matter we're sick or not, to see our doctor at least once or what?
Once per year.
Once per year, we need to see. So annual doctor's appointments. That's why I mentioned earlier, follow-ups are crucially important. But Dr. Kenya, I want to go back to we have statements like bacon and sausage and pan sausage, hot dogs.
Absolutely. And see, you guys, those are all processed meats. Okay.
Ooh, that's a good one.
Every last one of them is a processed meat.
Y'all hear that? Processed meat is horrible for us.
Smoked foods.
Smoked foods are bad. Did y'all hear that? Oh no.
And remember, folks, I'm telling you things just to be temperate. Temperance. Okay? These are all things that's okay for us to eat sometimes. But you can't have these types of foods being a regular part of your diet.
Oh, so no.
Temperance.
Okay. Okay, got something good for you. Lots of people get that Mexican candy and chips of Lacos. What is it? A La Casa, some is Mexican candy.
Interesting. That you got me there.
That was interesting. That was a good one.
So
I know, Keisha, everything we love.
Jim says you guys are telling me stuff, right? Yeah. My patients educate me too.
Really? Oh, that's what it is. Okay.
Too.
Yeah. Well, you just hurt my heart with the pickles. I don't like just regular pickles, but I like fried pickles. So I guess I'm really doing something bad when I have fried pickles.
Oh my goodness, that's indigestion for real.
Oh God. Look, my auntie say, look.
For people who have, like, I've
the Lucas.
who they have gastric cancer that runs in their family.
Oh my
okay?
God.
And then when I talk to them, I come to find out they eat a lot of smoked foods. Smoked foods are high in nitrates, and they tend to cause a lot of indigestion. They also drink a lot of soda pop. Anything that fizzes, anything that bubbles is high salt.
Oh no. Well, I'm not a big soda pop or whatever you want to call it drink. I don't do that, but that's a good way of us to look at it. So guys, when we're having these sonic drinks, yeah, that's me. Now I'm guilty of that. All that sugar, sweet. Yeah, I'm guilty of that. I like those every now and then, but I haven't been having them in over a month and a half. Keisha, you get me in trouble. She likes what I like. I'm seeing that. We can't be hanging together. Anything that frizzes and bubbles up, that's high in salt. Never knew that. Wow.
So, to my audience, okay, you
Listen.
know how, like, when you first have your children, take them in for their 1-month check, then their 2-month check, then 4 months, then 6 months, then 9 months. Okay, so it goes from 6 months to 9 months. Then from 9 months, you go to the 1 year.
Okay.
Then from 1 year to 18 months, and then from 18 months to 2 years. Now, for the audience, okay, the reason why those appointments are so close together is because we are doing our best to catch any genome type problems that
really
we didn't know about.
Interesting.
Okay, we're trying to catch that hip dysplasia.
Thank you,
we're trying
sissy.
to catch the shoulder dislocations. We're trying to
really
pick up on nervous system problems. Yes. So those visits, they seem silly. We do all these silly little things to the baby that really are profound. The suck reflex is really important. The rooting reflex, we're watching their eyes to see how they're tracked. These are all things that deal with the nervous system that by watching the child closely, we can a lot of times pick up on it before they get to school age and are really having problems.
My God, that's really interesting. I have a question for you. So how can we get the most out of our doctor's visit when we go? We see our annual doctor. You said at least once a year we need to have an appointment annually. So how can I and the audience receive the best from that visit?
Okay, so to my viewers, okay, remember I said you don't just go when you have a problem. Okay,
that's good.
So let's first define what a annual visit should be. Okay, once you cross 2 years old, okay, there are milestones still as we are aging for vaccinations. So that's one expectation.
Yes. Wow.
The second thing is we're continuing to look for diseases or disorders. Okay. Because again, we're talking about prevention. So that annual visit, you should be going in expecting to answer a lot of questions and to get your vaccines.
Wow.
That's the main thing, okay? Because remember, the goal is prevention.
Prevention is the goal, guys.
Yes. We're not trying to address anything that's acute or chronic in that visit.
That's interesting. That is interesting.
So to the audience that's listening, this is a very, very, very important distinction because a lot of people come to their physical exam thinking that, oh, this is the time that the doctor's going to manage my diabetes, my hypertension, and all my medications. No, that's the time they're just trying to keep stuff from getting worse and make sure that you're caught up with the basics. Then they're going to bring you back for that diabetes or that hypertension. And I know that some of you guys may look at that as, oh, they're just trying to make money off of me. No, it's so that we don't forget the routine things. Otherwise, we just start seeing you as a diabetic. And you don't want us to do that. You don't want us to do that, because then we lose sight of you as a whole person. So during that annual visit, folks, that is where I get a chance. Your doctor gets a chance to connect with you in a way that's just outside of your disease process. We get a chance to think about you in the continuum of your life.
That's good. So I have another question about intentional testing, because of what you mentioned earlier of the history of the family's medical conditions.
Okay, very good. So if I know that in somebody's family they are prone to diabetes, then guess what? As they, at least once a year, as they get to their adult age, I'm testing their sugars. I'm not just educating them on healthy eating and exercise. I'm also checking their sugar levels.
Wow.
Okay, if thyroid runs in someone's family, then I'm going to be checking that once they cross 20. I'm going to be checking that every year.
My goodness, there's so much information you've provided us with, Dr. Kenya, that we just were oblivious to. I've had so many comments, including my own, that we just didn't know. Everybody saying, wow, I didn't know that. I didn't know that. I didn't know that.
Yeah, so
you just taking all our good food away, though.
So for my audience out there, when you buy a brand new car, tell me, when do you take it in for, do you just wait until it's having a problem to take it in? What do you do to take care of that car, your brand new car?
Preventative care. We have to take it in, within the certain mileage that it tells us to.
That's right, exactly.
Wow.
The manufacturer has set up certain miles that you need to be taking that car in for a tune-up.
Whoa, guys, y'all are hearing this information?
That's the way our body is, okay? And so if we do that in your birthday month, that's what I've chosen. For my patients, I tell them I want to see them in their birthday month or their half birthday. Just depends on which is going to come first. And we do a top to bottom.
A top to bottom, I like that.
Yes. And
I like that.
Okay, for the audience, okay, there's certain testing that you should expect to be done as you hit certain milestones.
Okay.
So for those of you who are still let's start from adulthood, 18 years old.
So I can do it. Okay.
So at 18, there's generally going to be 2 more vaccines that you should be getting, depending on what you're going to be doing in life. Okay? And so that's why we ask questions. And that's usually going to be your meningococcal and the meningococcal B.
That's another one I don't know.
Everybody forgets about B. And you know what, Free? That's because you and I have aged out.
Wow. Okay.
So people who are already past their years of living in dorms or living the military life, where they're in close quarters with a whole bunch of other people, they've aged out. They don't need it at that point. But for those who are going to go to college, those who are going to go to the military, they need that. They need their hepatitis A, their hepatitis B. Okay, and so, I know everybody doesn't believe in vaccines, but the bottom line is that is something, that's a tool. It's just a tool. You can choose to use it or not, but that tool does help with preventing certain diseases.
Wow.
And so that's prevention. Now, once you hit 20, okay, so sometime before the age of 18, you should have had at least 1 cholesterol check and 1 CBC. For those of you who are out there who are asking, well, what's a CBC? A CBC is where we're looking at your white blood cell count,
Yes.
your red blood cell count,
Sissy.
and your platelets.
Wow.
Okay.
That's good information to put in those comments. I tell you, a big sissy is holding it down in the comments. She is actually placing things in the comments for us so that we can have this information. And I'm just blown away at some of the things that all the things that you told us, from processed foods to the certain testings that we need. And so does that come in to be beneficial to us when we follow the guidelines that are set by our doctor?
So absolutely. I mean, think about it. So what's the CBC gonna do, right?
Mhm.
It's gonna pick up leukemias, lymphomas,
Wow.
and anemias.
And
And
anemias.
thrombocytopenias. What in
Wow.
the world is a thrombocytopenia?
Yeah, what is that?
It's where your platelets are so low that you bleed easily. Okay? So if I got a mom who or a young adult who comes in and says,
Wow.
oh man, I'm always getting a bloody nose, or if I get a scratch, it takes forever for it to stop bleeding. Well, one of the first tests I can do is a CBC. So that's why every youth, before they hit adulthood or age 18, they should have had at least 1 CBC and 1 lipid panel. The lipid panel, you guys, is telling us about your risk for cardiovascular disease. So for heart attack,
Wow.
for vascular disease. And I know you guys are sitting there thinking to yourselves, what kid is worried about that? Well, the thing is, it helps us to know their eating habits.
The eating habits.
Okay?
Wow.
Yes, because plaques, everybody that's listening, these plaques, they don't just start when you're 40. They started when you were in grade school, from all the McDonald's, the hamburgers,
guilty of the McDonald's. The pizzas. In the past. I'm guilty of the McDonald's. I don't know if anybody else out there is with me on that one. We plenty of McDonald's food.
All of that starts laying down in our blood vessels. And so the more active we are, you get less of it that forms, but not everybody's gonna be running a marathon, okay? Or playing basketball. So we've gotta be looking for these things, okay? And no, we can't prevent everything, but at least we can try to catch it early enough so that you can do something about it before it becomes a death sentence, okay?
Nobody
now,
wants
that's
that.
Early adulthood, okay? Let me mention something else. Remember, Pap Smears, okay, for all the women who are listening. Am I talking too fast?
No, you're right on time. I don't know about anybody else out there. Is there anything on that we're not hearing? You're not hearing, guys? Because she's covering it for us. I'm hearing.
So for the women who are online, okay, Pap Smears, there's been a huge change in our recommendations for frequency.
Okay.
So let me bring everybody up to speed. We used to tell people that they should get, a young lady should start having their Pap Smears as soon as they start having sex.
Okay, yes.
We have now changed that. Now we say they should start having Pap Smears at the age of 21.
Whoa, age 21?
Yes.
Wow, that's good information. That's another good information. Oh, wait a minute, was it, I have to have my cells frozen and have to have one every year? That's one of the comments, Dr. Kenya. Dr. Kenya is on the line for those tuning in.
So if you have an abnormal Pap Smear, then they have to use cryo or what's called a leap. A leap is where they use an electric loop and they go in and they cut out the parts that are precancerous or cancerous. Okay? And so then you have to do that Pap every year until the woman has 3 normal Pap Smears.
Whoa.
So for those of you who are in the audience, what disease is it that we're trying to stop or screen for when we do a Pap Smear? smear? What are we screening for?
Any type of infectious disease?
Nope.
Nope. See, I'm wrong. Well, cancer cells in the
What kind?
vaginal, what do they call it? Cervical, cervical,
Cervical.
cervical
Yes.
cancer.
Cervical.
Yes, ovarian cancer. Yes,
Cervical.
sissy.
Nope.
Yes, Keisha.
Nope.
Yes. No, no,
Nope.
it's not that,
Nope.
guys, either. Oh,
No.
whoa.
When we do a Pap smear, people hear me. When we do a Pap smear, the only thing that we are testing for, unless you ask for something else, okay, is cervical cancer. That's it.
Cervical cancer. So I was right about the cervical. So it's not ovarian. Okay, okay, okay.
Yes. So
Whoa.
the reason,
I was going to say, what?
women, the reason why I am mentioning this to you
Mm-hmm.
is because if you go to the doctor, I've had a lot of young ladies who say, "Oh, I had a pelvic."
Wow.
What do you mean a pelvic? Okay, a pelvic is simply where they can be where we use our hands to go in to see if the ovaries are tender or to see if the woman might have fibroids on her uterus. We may do a cotton swab to see if the young lady has bacterial vaginosis or some other STD. But we are not looking for cancer.
Wow. See, I thought infectious disease. So okay, I was correct on that, and I was correct on the vaginal, the surgical
with
cancer.
Infectious disease, that is strictly a pill. We're not doing the sampling for the cancer cells. So you have to say that you want a Pap smear.
Okay, I get it. Now we have someone here that is stated, and she's also a nurse. She said that her 18-year-old goddaughter passed away from the cervical cancer. She said so testing at 21, because she was 18 at the time, she thought, could we be doing that younger than 21?
You guys, it's the saddest thing ever, right? When we have guidelines, right? Those are our guides. They're not supposed to be fixed in stones, but they are a guide, and those guides are based on statistics. So you're always going to have some outliers. You're going to have some people who fall outside of that.
Okay.
Now, I'm so glad that she brought that
thank
up.
God she's well. So, yes, Cousin D.
So for those of you who are listening, something that's very, very important for our young people is the Gardasil vaccine.
Gardasil vaccine?
Gardasil vaccine can be given as early as 8 years old, but cannot be given anymore after the age of 26.
Good question, Tan. I'm sorry. That was great. Everything that you're sharing with us is great. You have really awakened all of us on this line, and those that's going to listen even later, because there are a lot of things that you said, and I'm going to go back and listen again myself, because you've given some valuable information. But Tan mentioned, and I don't want to forget, I read it. She said, if you have a hysterectomy, excellent question. Should you still have a Pap smear, or what should you ask for? I should say.
Love it.
Yes, that's a great question. Excellent question.
So, if you had a hysterectomy because of a benign, a non-cancerous condition, you do not need to have a Pap smear.
Okay. What if go ahead.
Now, if you had it because of cervical cancer, okay, then usually they will do one more. Usually they'll do just one more Pap, like a year later, and then not do them anymore. And that would just be of what we call the cut. Okay?
Okay.
Now, for the men, so I've been on the women. Now, let me come to you men.
Okay, come on, men. Y'all hearing some stuff too.
For our young boys yes, we talked about the girls having the cervix. You boys have the testicles. Now, we always think of prostate for men, but
Mm-hmm.
we forget that testicular cancer is a young man's disease that usually happens during the teenage years.
Wow.
So, pediatricians are teaching, okay, when they ask you guys to leave the exam room, or sometimes
Yes.
they let you stand there with them, they're teaching the young boy how to check his testicle for cancer.
Oh, wow. Didn't know that.
Yes. And so we teach them how to take their hands and go down their seminal cord, okay, to the epididymis, which is that little fleshy thing that feels kind of like a soggy
Thank God for healing.
raisin. And then they go around what we would call kind of like the walnut, right?
Okay.
And it should be smooth. If you feel a hard lump in the
Amen.
testicle, then that is more than likely cancer.
Oh, man.
Okay, and so our young boys, especially from the age of 12 up to about 30, are going to be most at risk. And they're usually found during their high school years.
Wow.
So let's stay with men for a little bit. Then the next thing is at about age 45, our men should definitely be getting their colon cancer checked
Okay.
and their prostate.
Great,
Now,
great.
I know that a lot of you hear about age 50.
Mm-hmm.
The guidelines have finally caught up to the fact that people of color tend to get it sooner. And most of that, you guys, has to do with our diet. And so, again, if we change the way we eat, we shouldn't have that problem. But since we do, 45, okay, people, 45, you're going to get at least your colonoscopy or the Cologuard or just your regular stool test.
That's important, a stool test, much more than what we've been told or was never told about the stool testing. Can you kind of elaborate on the stool testing and how valuable that is that you get those type of testing?
Yes. So for those of you who don't have health insurance, the stool test is going to be the least expensive because I think it's only like $1, maybe $5 to do, okay, and interpret. And so long as you're doing that once a year, and so if you do that once a year, then that's just as good as having had a colonoscopy or a screen.
Yes.
Okay, people, for a screen. So that is going to pick up. What is it going to pick up? It's going to pick up blood that has come through the digestive tract.
Yes.
Now,
wow.
Because it's not visual, it is just a symptom that has been caught, right? Mm-hmm. So then you have to have what's called an upper and lower endoscopy.
Upper and lower, and that's enough. I'm so glad you spoke about endoscopies and colonoscopies. We need to kind of get into, because people say endoscopies, colonoscopies. Yeah, we need all of that type of. Oh my goodness, so you're hitting on some good stuff.
The word endoscopy just means that you are using a scope and going through the orifice. Okay, wow. And so an upper is where they are going through the mouth down into the gastrum, okay? Whereas the colonoscopy is where they're going through the rectum into the colon.
Whoa. Whoa, whoa, whoa.
So when people use the term upper and lower, that's what's happening.
Upper and lower. Let me give you some comments. Greg says people think they are too young to have certain health problems, and if with parents, they think their child doesn't need that, it's not necessary. And there were some other good comments about the males. I don't want to miss any good comments. I say, these men are not checking nothing. It's shameful. There are a lot of young men with one testicle. I know of a gentleman that shared that information with me that was counseling, and it's due to an accident, but she's referring to like not taking care of themselves and lack of care, and no one taught them to check themselves. That is something.
Yeah, and so you guys, something that scares the bejeebers out of me is these kids that go to these little free places, or they just pay $10 and they're able to have their school sports physical.
Yes, yes.
Please, please, please understand that that is not the same thing as a well child check.
Wow, did y'all hear that? Now that's some serious info. That right there put a pin in why we have heard about kids that had their exam, at the beginning of school year, but then they had a massive heart attack on the basketball court.
Yeah,
Wow.
because it's not the same. So
Wow.
when you take your child into their pediatrician or family doctor for a well child check, and you say, oh, by the way, we need this sports physical filled out, then you can count on getting the whole shebang, okay? But if you come in there or to some of these little places where they say, oh, yeah, meet us at the basketball court, we've got a doctor who's volunteering to do the screens for sports physicals.
Wow, that's so deceiving and misleading.
It's not that it's deceiving. It's just different. That sports physical, you guys, what they're screening for is head concussions and history thereof, so that they can prevent brain damage. They're screening for respiratory issues. So like if a child has asthma, they're screening for Marfan syndrome. And your question might be, well, goodness gracious, what is that? Some of these kids that are really, really tall and lanky, they have certain physiologic, morphologies that put them at risk for heart disease. Okay, and so you might be looking at them thinking, wow,
it's
that
very
person
important.
was
Okay.
great for our basketball team or our volleyball team. Guess what? That kid's actually got Marfan syndrome.
Sonia, I'm looking for it.
Cannot play. So that's what a sports physical is. And then we're supposed to be, I don't know that all of the docs are doing this. They're supposed to be checking the heart and looking for something. Write this down. PMI.
PMI.
PMI. That stands for
PMI, big sissy.
Of maximal impulse.
Wow.
Point of maximal impulse. That is where the tip of the heart is hitting. When it is displaced,
okay,
that's our first clue.
That's good. Thank you for addressing that.
Who could have cardiomyopathy and be one of those who we call the athletic heart, where they drop dead. It's dilated cardiomyopathy.
Wow. Okay, there was a nurse that addressed a question for you, because one of the individuals said that she's had a hysterectomy, she's still having fallopian tubes and her ovaries, but every 3 months or so, but every time she make an appointment, she would bleed a lot. And so the nurse just kind of informed her that you're kind of doing just general stuff, which that's our disclaimer, everyone. Let me just piggyback off of what the nurse addressed it. Thank you so much, Lakita, for doing that. She said that she needs to go to her doctor, primary care, because Dr. Kenya is not none of us on the line, including myself. Let me stress, that's why I said including me. She's not our general practitioner. You need to follow up. This is a Facebook diagnosis, because she is just giving us general information of preventative care. And so she's giving you general things so that it will ignite you to go to your physician. It gets you so
Exactly.
much excited, yes, about the information that it causes you to learn about your family history, your medical history. Talk to your doctor. Yes, and Greg followed up with what you said, Dr. Kenyon said these places just want to see your heart is beating, heart rate after movement for these type of things. So again, I'm so grateful that you guys understand that this is just simply free little talk, bringing you some very significant information, very valuable information, but it's for you to go back to your general practitioner and speak with that doctor about your healthcare matters. I hope I've said that correctly for you, Dr. Kenya.
Yes, yes, you did. Because again, I not even getting the chance to talk with you about all the different things that are going on in your life. And so hopefully what I've done in this presentation is helped you to understand why we ask so many nosy questions.
Yes,
It truly is so that we can have a better idea of how to help give you guidance. And
absolutely.
so, of
Absolutely.
course, if somebody has diabetes that's uncontrolled, they're going to be seen at least every 3 months.
Yes,
And
yes.
every 6 months if they're controlled.
Wow.
Hypertension, you're going to be seen every 3 months at least if it's uncontrolled, and only 2 times a year if it's controlled. Now remember, that's not the same as your physical. So don't
Absolutely.
be mad if you get that doctor who says, no, now you're going to come back for us to deal with your hypertension and diabetes. Some doctors will do that. Others will take care of it
Yes.
all at the same time. So just understand that that is a
Thank you
practice
so
style.
much, Keisha. Thank you. I am just so, so grateful for everyone who tuned in to hear this information and those that had to come in and out and those that is going to come back and listen later. Dr. Kenya said it better than I could have said it. She said, this is just information to ignite your insides to go forward in your thinking and your understanding of your health. I love the way Lakita said, take charge of your health. So we just thank you again, Dr. Kenya. We hate that you had some difficulties getting on, but hey, she gave you guys a lot of information by phone. So, is there any parting information that you want to give to us? And we thank you. Everybody saying thank you, Dr. Kenya.
All right. So in closing, just keep in mind that a physical is your top to bottom, and from the age of 2 to the day you die, you should go in once a year.
Okay, you
That's
hear that?
really my main take home.
I love it. Everybody says thank you, Dr. Kenya, for the great information. I thank you guys always for tuning in to Simply Free Little Talk. Thank you again, Dr. Kenya. We're so glad you're back. We got some great, great, great information coming down on health matters. This is only the beginning of greatness for the year 2022. We're going to have CT text, what is something? MRI text, excuse me, I couldn't get it out for a second there, and then other techs that want to come and share information with you as well to tell you about specifics of your body. So again, we thank you, Dr. Kenya. We thank you, audience, for tuning in. Simply Free Little Talk. Dr. Kenya will be back with some great information for you. Thank y'all so, so much. We appreciate you with your questions, with your feedback. We love you, love you, love you, and thank you. Be blessed.